Hi, welcome to Dental Canvas. I am Dr. Gopal Kasat, and in this episode, we will be discussing the anatomy of the permanent mandibular central incisor. Before going ahead, if you are new to this series, check the description or refer to the video on the right top corner to learn basic terminologies required for a better understanding of this video. Now, let us start with the labial aspect of the mandibular right central incisor. The average length of the crown is 9.5 mm from the cervical line to the incisal edge. Mesial and distal outline flares outward from the cervical line till the contact areas that lie in the incisal 1/3, after which it makes a straight line till incisal angles. Mesiodistal width of the crown is 5 mm at the contact areas. Mesiodistal width of the crown at cervix is 3.5 mm. Mesio-incisal angle and disto-incisal angle are relatively sharp compared to maxillary incisors. Incisal edge of the crown is straight and approximately at the right angle to the long axis of the tooth. Now let us move on to the root. Length of the root is 12.5 mm. Mesial and distal outlines are straight till the apical third, after which it curves distally. Now let us move on to the lingual aspect. The cervical line is similar to that of the labial aspect with the curvature rootwise. Just below the cervical line, there is a smooth convexity known as cingulum. Lingual surface of the crown is smooth with very slight concavity at the incisal 1/3, known as lingual fossa, which lies between the inconspicuous marginal ridges. Now let us move on to the mesial aspect. Outline of the labial face of the crown is somewhat straight from the cervical line till the crest of curvature, which lies in the cervical 1/3, sloping rapidly from the crest of curvature to the incisal edge. Lingual outline of the crown above the cervical line is a smooth convexity in the cervical 1/3, followed by a straight line inclined labially for a short distance, which joins the concavity at the middle 1/3 of the crown, which extends upward to join the rounded outline of a narrow incisal ridge. Labiolingual width of the crown is 6.5 mm. Labiolingual width at the cervix is 5.3 mm. The curvature of the cervical line representing the cemento-enamel junction on the mesial surface is 3 mm and is towards the incisal edge. Now let us move on to the root. Root outline is relatively straight from the cervical line till middle 1/3, below which it starts to taper and ends in a bluntly rounded apex. Roots of the mandibular central incisor have broad developmental depression for most of the root length. The incisal ridge is usually lingual to the center of the root. Similarly, from the distal aspect, the curvature of the cervical line is 2 mm and is towards the incisal edge. The developmental depression on the distal surface of the root is more prominent. Now let us move on to the incisal aspect. The incisal aspect illustrates the bilateral symmetry, that is, the mesial half of the crown is almost identical with the distal half. In mandibular central incisor, the labiolingual diameter of the crown is always greater than the mesiodistal diameter of the crown. The labial surface of the crown is wider mesiodistally than the lingual surface. Incisal edge is almost at the right angle to a line bisecting the crown labiolingually. This feature is a characteristic of this tooth and serves as a mark of identification in differentiating between mandibular central and lateral incisor. From the incisal aspect, more of the labial surface can be seen than the lingual surface, as the incisal ridge is lingual to the line passing through the center. This completes all the 5 surfaces of the mandibular lateral incisor. To summarize it all, you can see a picture on the screen with all the average dimensions and key features. To download the same and see our resources, check the description. If you have learned something, hit the like button and feel free to subscribe. Looking forward to your comments. Thanks for watching. I am Dr. Gopal and you have been watching Dental Canvas. See you all in the next one.